Today we will do a dissection for the cow eye. First, a few things before we actually go for the dissection. We need tools. I have a scalpel here. I have a forceps, scissor we will need, and a blunt probe. And then I also have another tray on the side, so that way whatever the animal parts we will be removing, we can collect it. It will be easy to discard it at the end of our dissection. And here are some pins to put on the structures. And this is to start. I also have a bottle of water handy, because if it gets too dry or if I get too irritated with the preservative, I can spray with water, and also some paper towels handy. First, I wanted to show the way we get the cow eye. And a lot of time we get questions, where do we get this from? These we get from suppliers. We have approved biological suppliers. That's where we get this from. The reason I have few of these to show, there could be a different possible way you might get the cow eye. Some of those might have huge amount of fat. Some others might not be that bad. You will be able to see the pupil easily, and some could be in between or so. So if you get a specimen with huge amount of fat, that will take a little more time than, say, for instance, this one. Before we actually do the dissection, we have to be careful about the orientation, anterior versus posterior, lateral, medial. So when there is lots of fat around, we really have to clear, to go over to look at the cornea. And then posteriorly, the major landmark posteriorly is the optic nerve or optic tract. If you tap it with the probe, if you are not sure, you can feel it. You will see it's a pretty strong rope-like structure. For this specimen, there's a lot of fat at the anterior. But this one, interior, we can see clearly. This part, what we are seeing here, that's the cornea. That's the transparent part of the white section, the layer, protective layer called sclera. Here for this specimen, there is more fat at the posterior part. Once you determine where the optic nerve is, and again remember, direction wise it will be pointing upward, and then here we can see the cornea. Now it will be easier also to identify, this will be lateral, this will be medial. For the eye, the way eye is socketed, and also with the eye movement, there are 6 prominent muscles. Depending on how the eyeball has been removed from the animal, sometimes we will be able to see all of those, sometimes might not be. So again, confirming the location, this is posterior, superior, this is lateral, medial. So 4 rectus group of muscles we can see distinctly here. This is superior rectus. Here is the inferior rectus muscle, and then this is the lateral. See the lateral rectus, and here is the medial rectus muscle. So these are the first landmarks. You can see some of the muscles for this sample as well. Optic nerve again on this side, so this has to be the medial rectus. Always be careful about the orientation, because that is very important. So now what I will do, I will start removing this extra fat layer surrounding the eyeball. Otherwise it will be impossible to dissect the eyeball. So when these fats are all around, you can see lots of those are hanging out. It is little easier to know, and always make sure that you feel underneath before making any cut or any removal. And when there is the areas where there are less fat, it have to be more careful. So it will take a little time before we could clear up all the fat layers, and then would start with the dissection. I have cleaned up the fat. See how much fat and all of those muscles are there. So let's move it out of our way, and now you can see the eyes ball more neatly and distinctly. And look over here, I cleaned out the fat around the optic nerve. So what we will do now, we will make an incision. So here of course few important things to remember and tips. The way I do, if you put a little pressure, you can see that it will become like a puffy ball. Make a ballpark estimate from the optic nerve to the cornea at the front, about 1/3 of the direction towards anterior. And this time we will use scalpel, but before we use scalpel, what we will do, I will make a little incision with the scissor, and then what happens, once we open it, you will be able to see it clearly. But right behind this cornea, there is the lens, and the lens divides eye into two distinct regions called the anterior segment and posterior segment. In both of these segments, there are two kinds of materials there. Anterior segment, there is aqueous humor, which is very liquid, and that's what we have to be careful at the beginning so that we do not get squirted with that fluid. The posterior segment is filled up with vitreous humor, which is like a jelly-like material. So I did make that incision, and now what I will do, I will use the scalpel to go from all the way around on both sides. Again, you will be handling the scalpel, so be very careful about the incision and your hand. Okay, so I am following it, and the more you clean the muscle and the fat, it will be little easier. You still see that fluid is coming out. That's the aqueous humor, and that aqueous humor is circulated around the eye, and then drained out, reduced, recirculated. If that fluid builds up, that's when we get the condition called glaucoma. Always be careful when using the scalpel, very sharp. We do not want any accident or injury. Here we are looking beautifully. vitreous humor in the posterior chamber. This is lens. If we remove the lens on the other side, that means in between the cornea, pupil and the lens, there is that anterior chamber filled up with aqueous humor. What I did now, I completely separated the two parts of eye, and look over here, I left the aqueous humor to show you completely watery liquid, and this is the vitreous humor. You can distinctly see it's a gel-like consistency. Before we go to any other structure, let's look at the layers of eye. So where I am putting the pin, and now you will see why I wanted to have some pins handy. The yellow pin is at sclera. Now let me use a black pin. That's the middle layer. That's choroid. And then see this beautiful light colored layer, looks a little frilled. That's retina. Let me put a blue pin in there. So you can distinctly see three layers: sclera with the yellow pin, the middle layer choroid, the vascular layer, and the blue pin is on retina. The innermost layer, and that's the neural layer with the rods and cones of the photoreceptors. I scooped out all the vitreous humor from this side of the dissected eye. Now I will gently remove the lens. This is a delicate protein. Surrounding that, there is a ciliary body with suspensory ligament, which helps in focusing the lens to adjust the distance. So if you look over here, that's the opening through the cornea, the pupil. And here in the posterior chamber, I did put two pins in here, a blue and a red pin. That layer is a retina. At the posterior part, where the neural layer is merging to form the optic nerve, there you can see that round structure with the red pin. That's called optic disc or blind spot. Now if I put a pink pin, and that's a new layer, see, that is called that bright shiny layer. If we gently move retina, you will be able to see that's called tapetum lucidum. That is tapetum lucidum. So here again, posteriorly, three different regions of eye. So at the end, let's do a recap, a review. After all the extra fat or adipose tissue has been removed, we can see the eyeball like this, with the very outer part, the white part, with the yellow pin sclera. And then if we gently push from here, we will be able to see the cornea, and then posteriorly we can see the optic nerve at the black pin. We have talked about it at the very beginning. We can see the superior rectus muscle here. Then after dissection, at the green pin, we can see the lens have been taken out, the aqueous humor from the anterior chamber. There we can see at the light green pin, that's the pupil, which is surrounded by a circular structure. That entire circular structure is called the ciliary body. There are different parts, very interior layer is called the ciliary zonule, then ciliary body, ciliary muscle, then ora serrata. That's at that whole layer is at the white pin. Now let's look at the three layers from outer part. Yellow again with the sclera. Orange pin is at the choroid layer, that's the vascular layer. The blue pin is at retina. Underneath the retina, for cow eye, we can see the tapetum lucidum, that bright shiny layer. And then the red pin is at optic disc or blind spot. And photoreceptors, the rods and cones are located on the retina. I hope you followed it. So now you will be able to do your dissection, review, and practice. Also, don't forget the cleaning and proper disposal procedure after you are done.